following instruction will provide guidelines on how to perform and proctor a submaximal graded exercise test while measuring the electrical activity of the heart. The purpose of this test is to identify irregularities in the heart rhythm that may be induced by stress produced from an exercise test. This test utilizes the YMCA protocol, which will consist of at least 3 stages and varying workloads depending on the first steady-state heart rate. To begin a stress ECG test, the subject must be prepped. Have the subject remove their shirt and rest their arms at their sides. If the subject is uncomfortable with removing their shirt in the testing room, take the subject to a more private area to apply the electrodes. Prepare the electrode placement areas with alcohol wipes and allow for the areas to air dry. The placement areas may need to be shaved if the electrodes cannot reach the skin's surface or if they do not maintain adherence to the chest. After the surface has been prepped, begin placing the electrodes starting with the limb leads. Place the right and left arm leads in the space under the right and left clavicles. The chest leads may now be placed starting with V1 in the 4th intercostal space to the right of the sternum. This lead should be approximately at level with the nipples on male subjects. V2 mirrors V1 to the left of the sternum. Next, find the intersection of the 5th intercostal space and the midclavicular line and place V4 in this space. Place V3 directly between V2 and V4 in a linear fashion. Next, place V6 in the intersection of the 5th intercostal space in the mid-axillary line and place V5 directly in between V4 and V6 in the 5th intercostal space. Next, place the right and left leg leads in the meaty area just above the iliac crest or hip bones. Finally, attach the ECG lead wires to the proper leads. Now, adjust the seat to the subject and begin the YMCA protocol.